Welcome to Vital Health Guide. Today, we will explore 13 common reasons why you wake up to pee during the night. Waking up frequently disrupts your sleep cycle and leaves you feeling completely exhausted throughout the entire following morning and afternoon. This condition is medically known as nocturia, and it affects millions of adults around the world every single night consistently. We will break down these causes from simple lifestyle habits to more serious underlying medical conditions requiring immediate doctor visits. Let us start with the most basic lifestyle factors that might be secretly ruining your precious deep sleep every night. Reason number 1 is simply drinking way too much water or fluid right before you go to your comfortable bed. Hydration is very important for health, but consuming large amounts of liquids late at night fills your bladder very quickly. Your kidneys continue processing these fluids while you sleep, causing an urgent need to visit the bathroom before morning arrives. To fix this specific issue, try to stop drinking any heavy fluids about 2 hours before your planned sleeping time. Reason number 2 involves consuming alcoholic beverages during the evening hours, which heavily impacts your normal fluid regulation system internally. Alcohol actively suppresses the antidiuretic hormone in your brain, forcing your kidneys to produce significantly more urine than usual tonight. Even a single glass of wine before bed can disrupt this delicate hormonal balance and wake you up multiple times. Moving on to reason number 3, we have caffeine consumption, which acts as a powerful stimulant and mild diuretic agent. Drinking coffee or strong tea in the late afternoon not only keeps you awake, but also stimulates your sensitive bladder. Caffeine increases blood flow to the kidneys, which naturally accelerates the rapid production of urine throughout the quiet evening hours. Reason number 4 is eating very salty foods or having large, heavy meals right before going to sleep at night. High sodium intake forces your body to retain excess fluid, which eventually needs to be flushed out through your kidneys. When you lie down, this retained fluid moves back into your bloodstream and fills up your bladder quite rapidly indeed. Try to avoid salty snacks like potato chips or processed meats during those critical hours just before your bedtime routine. Now let us transition into the second group of causes, which involve sleep disorders and mechanical issues within your body. Reason number 5 is a fascinating psychological illusion where you actually suffer from insomnia first before noticing your full bladder. You wake up because of stress or anxiety and then realize you could pee, assuming the bladder woke you up. In reality, your brain woke up first, and the bathroom visit is just a secondary action to pass the time. Treating the underlying anxiety and improving your sleep environment can effectively eliminate this deceptive form of nighttime bathroom visiting completely. Reason number 6 is an overactive bladder, which is a very common condition, especially among adult women across the globe. This condition causes sudden and intense urges to urinate, even when your bladder is not completely full during the night. The bladder muscles contract involuntarily, sending urgent signals to your brain that immediately wake you from a very deep slumber. Pelvic floor exercises and specific medications prescribed by doctors can help calm these unpredictable muscle spasms and restore peaceful sleep. We now enter the third category, focusing heavily on natural physiological changes and the inevitable aging process of our bodies. Reason number 7 involves significant hormonal changes, particularly in women who are going through the natural phase of female menopause. During menopause, the body produces much less estrogen, which directly weakens the supportive tissues surrounding the bladder and urinary tract. This tissue weakness makes the bladder much more sensitive and less capable of holding urine for extended periods of time. Reason number 8 affects older men and is known as benign prostatic hyperplasia, or simply an enlarged prostate gland today. As men age, their prostate naturally grows larger and begins to squeeze the urethra, blocking the normal flow of urine. This blockage prevents the bladder from emptying completely during the day, leaving residual fluid that causes frequent waking at night. Medical treatments and lifestyle adjustments can significantly reduce prostate swelling, allowing men to sleep soundly without constant bathroom interruptions tonight. Now we must discuss the final and most serious category involving hidden medical conditions that require your absolute full attention. Reason number 9 is undiagnosed high blood pressure and the strange way your body redistributes fluids when lying down flat. During the day, gravity pulls fluids down into your legs, causing mild swelling that you might not even notice immediately. When you lie flat at night, this fluid rushes back to your kidneys, generating a massive volume of new urine. Elevating your legs in the evening can help process this fluid earlier so you do not wake up past midnight. Reason number 10 is sleep apnea, which is a highly dangerous breathing disorder that often goes completely unnoticed by patients. But when your breathing stops temporarily, your heart panics and releases a special protein that signals kidneys to produce more urine. Many people think they wake up to pee, but they actually woke up because they stopped breathing for several seconds. Treating sleep apnea with a breathing machine often cures nighttime urination problems instantly, like pure magic for many exhausted patients. Reason number 11 involves insulin resistance prediabetes and full-blown diabetes, which drastically alters your internal blood sugar chemistry levels. When blood sugar is too high, your kidneys work overtime to filter and absorb the dangerous excess glucose floating around. To flush out this extra sugar, the kidneys pull extra water from your tissues, creating huge amounts of frequent urine. If you are always thirsty and peeing constantly, please get your blood sugar checked by a doctor very soon today. Reason number 12 points to chronic kidney disease or early stages of heart failure affecting your overall blood circulation deeply. Weakened kidneys lose their ability to concentrate urine properly, meaning they produce large volumes of watery urine day and night. A weak heart fails to pump blood efficiently, leading to fluid buildup that the kidneys desperately try to eliminate constantly. These conditions are highly severe and require comprehensive medical management to protect your vital organs from facing permanent structural damage. Finally, reason number 13 is the rare but terrifying possibility of cancer developing inside the prostate or the sensitive bladder. Tumors growing in these sensitive areas can press against the urinary tract, causing irritation and sudden urges to urinate frequently. If you ever notice any visible blood in your urine, you must seek emergency medical evaluation without any further delay. Now that we understand these 13 reasons, let us explore some highly effective strategies to stop this annoying midnight problem. First, maintain a daily fluid diary to track exactly what and when you are drinking throughout your busy waking hours. Shift your primary hydration to the morning and early afternoon, ensuring your body is fully hydrated long before the evening. Cut off all heavy liquids completely at least 2 full hours before you intend to fall asleep in your bed. Second, strictly limit your intake of alcohol and caffeine, especially as the sun begins to set in the late afternoon. Replace evening coffee or wine with soothing herbal teas like chamomile, which relax the body without overstimulating the delicate bladder. Third, pay close attention to your dinner plate and avoid excessively salty or spicy meals late in the quiet evening. Fourth, if you experience swollen legs, try wearing compression socks during the day to prevent heavy fluid accumulation down there. Elevate your legs above your heart level for 30 minutes before bed to help kidneys process fluids while still awake. Fifth, optimize your bedroom environment to reduce anxiety and prevent those false insomnia awakenings that trick your tired brain completely. Keep the room cool, dark, and quiet, utilizing blackout curtains or white noise machines to maintain deep, uninterrupted, peaceful sleep. Sixth, perform daily pelvic floor exercises to strengthen the muscles that control your bladder capacity and reduce sudden, urgent spasms. These simple exercises are highly effective for both men and women looking to regain full control over their bodily functions. Seventh, review your current medications with a doctor, because some blood pressure pills act as strong diuretics during the night. Taking these specific medications in the morning instead of the evening might instantly solve your frustrating nighttime bathroom visitation struggles. Or eighth, if you snore loudly or feel exhausted. Daily request a professional sleep study to check for hidden sleep apnea. Using a continuous positive airway pressure machine will keep your oxygen levels stable and stop excessive nighttime urine production completely. Ninth, monitor your blood sugar levels regularly, especially if you have a family history of diabetes or metabolic syndrome issues. Maintaining a healthy diet and exercising daily can reverse prediabetes and protect your kidneys from dangerous sugar overload over time. 10th, older men should schedule annual prostate exams to catch benign enlargement early before it severely blocks the urinary tract. Prescription medications can shrink an enlarged prostate, rapidly restoring normal urine flow and allowing for completely uninterrupted sleep every night. Women experiencing menopause symptoms should consult their gynecologist about safe local estrogen therapies to strengthen their weakened sensitive bladder tissues. It is crucial to remember that waking up once per night is generally considered normal for most healthy aging adults. However, if you are waking up 2 or 3 times consistently, it is time to take proactive medical action now. Ignoring severe nocturia can lead to chronic sleep deprivation, which drastically weakens your immune system and ruins your cognitive focus. Poor sleep quality also increases your risk of depression, weight gain, and dangerous cardiovascular diseases over a long time period. For elderly individuals, frequent nighttime bathroom trips significantly increase the terrible risk of falling and breaking fragile bones in darkness. Installing motion sensor nightlights in your hallway can prevent these tragic accidents while keeping the environment dim enough for sleep. Do not feel embarrassed to discuss these intimate bathroom issues openly with your trusted family doctor during routine medical checkups. Medical professionals deal with urinary problems every single day, and they have amazing tools to diagnose your exact hidden condition. A simple urine test and basic blood work can easily rule out dangerous infections, diabetes, and early-stage kidney disease. Sometimes the solution is as simple as changing when you drink water, rather than taking any complex prescription heavy drugs. Listen to your body carefully, because it always sends subtle warning signals before a minor issue becomes a major crisis. Your health is your most valuable asset, and getting 8 hours of solid sleep is the best daily medicine available. We hope this comprehensive guide has shed light on why you might be struggling with those annoying late-night awakenings. By making small, smart adjustments to your daily routine, you can easily reclaim your restful nights and highly energetic mornings. And share this important video with friends and family members who might also be suffering silently from chronic sleep disruption tonight. Education is the first critical step toward healing and improving our overall quality of life in this modern, stressful world. If you found this information valuable, please hit the like button and subscribe for more excellent medical science content weekly. Leave a comment below sharing which of these 13 reasons surprised you the most during our detailed educational presentation today. Thank you for watching Vital Health Guide. We wish you a wonderful deep sleep tonight and perfect health always. Goodbye. Educational disclaimer. This video is created for educational purposes only. Some images and animations may be generated using AI to visually represent medical and anatomical concepts. The information is based on general scientific knowledge and is not a substitute for professional medical advice, diagnosis, or treatment. Please consult a licensed healthcare professional for personal medical concerns.